For gross motor milestone assessment below the age of 6 months, 180-degree flip maneuver is used. First, observe the infant in the supine position. Look at the position of the head and the limbs. Less than 6 weeks of age, the head is usually turned to one side and there may be presence of persistent or intermittent asymmetric tonic neck reflex. That means the arm and the leg which are towards the side of the face are extended and the ones which are towards the side of the occiput are flexed. So this may be the position of observed ATNR. Also see if the baby attempts to lift his head above the level of the couch as someone approaches. This is seen usually beyond 20 weeks of age. Next, the baby is attempted to be pulled to sitting position using either the wrists or even sometimes. So when the child is pulled to the sitting position, observe the position of the head and the trunk. So in the newborn up to 4 weeks of age, there is usually complete head lag. Thereafter the neck control appears due to strengthening of the neck extensor muscles and there is less and less head lag. So that by 12 weeks, mostly there is no head lag. Also, after pull to sit position, observe the child in held sitting posture. In this, see if the back of the baby is rounded. That usually happens till 6 weeks of age, and then gradually as the trunk muscles get strengthened, the trunk becomes more and more straight. Next, the child is held in the vertical suspension and it is seen whether the child tends to slip as in the cases of hypotonia or is he steady. Then the child in the held standing position, look at whether the baby can bear weight on his lower limbs or whether his pelvis and the knees sag. Also see if he has intermittent walking reflex as he is made to stand in the held standing position. In the ventral suspension so that he is in the prone position but off the couch held by the abdomen. In this position, that is the ventral suspension, look at the position of the head, the trunk and the limbs. The newborn up to 4 weeks of age, there is complete head lag and there is usually flexion of the lower limbs and the upper limbs. By 6 weeks, the head is consistently at the level of the body and after that there may be even the extension of the head beyond the level of the plane of the body. Last but not the least, the child is put in the prone position. In the prone position, what is usually observed that in the newborn up to 4 weeks of age, the knees are drawn below the pelvis so that the pelvis is high up. And as the age proceeds, gradually there is extension of the lower limbs so that by 6 weeks they are almost straight. And initially in the newborn period, the baby is not able to clear his head off the couch, but then there is by 6 weeks there is intermittent raising of the head above to the level of the plane. Then by 12 weeks there is some weight bearing over the flexed arms and the forearms bear the weight and there is some upper part of the chest is also lifted. By 20 weeks the child is able to lift most of the chest and bears his weight on extended arms. So this is the gross motor assessment till the age of 6 months.